Hi guys, this is my overview of clinical symptoms of schizophrenia public service announcement. Schizophrenia is a disorder characterized by disturbances in thought, emotion, and behavior. Um, Schizophrenia is one of the most severe mental health disorders. The prevalence rate is less than 1%, and it is more likely found in men than in women. There are 3 clusters of symptoms, and the clusters are very important in diagnosing and treating schizophrenia. The clusters are positive, negative, and disorganized. Positive symptoms are made up of hallucinations and delusions, and they are acute episodes. The delusions are beliefs held contrary to reality and firmly held in spite of disconfirming evidence, and that is found in 65% of schizophrenia patients. Hallucinations are sensory experiences in the absence of any relevant stimulation from the environment. They are more auditory than visual. The negative symptoms are behavioral deficits. They are avolition, which is lack of motivation and absence of interest; alogia, significant reduction in amount of speech; anhedonia, which is loss of interest in pleasurable experiences; flat affect, which is lack of outward expression of emotion; and asociality, impairment severely in social relationships. Lastly, the disorganized symptoms are disorganized speech, which is formal thoughts that are disordered and organized, and they come out speaking where your listener wouldn't understand. And there's disorganized behavior, which is agitation, dressing unusual, acting childlike, hoarding. They lose the ability to organize their behavior. There are also 2 other important symptoms that do not fit into either of these clusters, and they are catatonia and inappropriate affect. They are both very rare. Catatonia deals with several motor abilities, and then catatonic immobility is the opposite. The people with that adopt unusual positions and maintain them for very long periods of time. Inappropriate affect would be emotional responses that are out of context. For instance, if someone had passed away, normally you would give them your condolences and there would be sympathy and empathy. Whereas an inappropriate affect, a reaction could be laughing about that. The DSM requires symptoms to last for 6 months for a diagnosis of schizophrenia, and 1 month must be acute episode with the presence of at least 2 of the following options: hallucinations, delusions, disorganized behavior, or any of the negative symptoms. So that's my public service announcement. Thank you for listening.